My name is Dr. Mustafa Yakoot. I am going to present summary of our original article published in Clinical Interventions in Aging titled Effect of a Combined Natural Formula on Mini-Mental State Examination Score in Patients with Mild Cognitive Impairment. Mild cognitive impairment encompasses the clinical continuum between normal age-related changes in cognition and dementia. And this figure from the National Institute on Aging depicts this early phase of mild cognitive impairment, where the early identification of Alzheimer's disease and the insidious onset vascular dementia represents an opportunity for clinical interventions that may hopefully arrest or even reverse cognitive deterioration. Many investigators have already demonstrated the cognitive enhancing effects of both Ginkgo biloba and Panax ginseng used single or combined on human subjects through many confirmed mechanisms mentioned in our full article. Royal jelly recently was found to facilitate the differentiation of all types of brain cells, neurons, astrocytes, and oligodendrocytes through its content of many bioactive components such as the 10-hydroxy-decyanoic acid and adenosine monophosphate N1 oxide that differently influence neuronal and or glial lineages. Royal jelly intake for 6 months has demonstrated significantly better effect versus placebo on mental health subscales of the Quality of Life Questionnaire SF-36. We hypothesized here that combining the 3 substances, Ginkgo biloba, Panax ginseng, and royal jelly, could provide cognitive benefits through the summation of many additive and complementary mechanisms. Memo is a dietary supplement formula produced by pharmaceuticals in the form of soft gelatin capsules, combining lyophilized royal jelly 750 mg with the standardized extracts of Ginkgo biloba and Panax ginseng. We planned this study to explore the effect of this triple natural formula, Memo, on mini-mental state examination scoring in patients with mild cognitive impairment. Out of 88 subjects assessed for eligibility, 66 were found eligible and randomized to either an experimental group treated with Memo, 1 capsule before breakfast daily for 4 weeks, or a control group treated with placebo for the same period and same dose. During the period of follow-up, 3 subjects out of each group were dropped out, and the final analysis included 30 subjects from both groups. The methods: 66 subjects presenting with forgetfulness and satisfying the DSM-4 text revision clinical criteria of mild cognitive impairment were randomly divided into an experimental group treated with Memo, 1 capsule before breakfast daily for 4 weeks, or a control group who took placebo in a matched dose and duration. Mean difference of mini-mental state examination score from baseline and reported adverse effects were compared between both groups. This table shows that the baseline characteristics of both groups were almost matched, including the age, sex, baseline mini-mental state examination score, and the educational level. This figure depicts the effect of Memo on the baseline change from baseline in mini-mental state examination score in both males and female. This was found to be significantly higher than the placebo group. This effect also was held true after adjustment for the treatment effect by age as a covariate and educational level as a factor nested within treatment groups by ANCOVA model, where the corrected model was also found to be highly significant. In conclusion, this triple combined formula may be beneficial in the treatment of the cognitive decline that occurs during the aging process as well as in the early phases of pathological cognitive impairment that typically occurs in the insidious onset vascular dementia and in the early stages of Alzheimer's disease. Thank you very much.